Greetings of peace to everybody. Hopefully, you're doing well. Here we are today on another program on ShuraTV on health. And today we're looking forward to discussing a couple of things that were discussed that were brought up for us. It was the issue of osteoporosis and osteoarthritis. We'll be discussing that shortly, and what to look for and how to get treatment and how to make sure that you don't suffer from these things and that you do things that prevent those types of pathologies from occurring in your body. It's obviously very common in the elderly, and we want to get in front of that and let our viewers know what to look for and how to go about their lives living in an optimal way to avoid getting osteoarthritis or osteoporosis. Those are the things that we're looking at. Before we get into that, in general, we have more information on the Omicron strain or variant of COVID. Fortunately, the studies that came out of South Africa initially have proven to be true. It is highly transmissible, but at the same time, we've seen it in more children and younger people are getting admitted. And still, the majority of people that are getting admitted to hospital are the unvaccinated. So that is something to keep in mind and make sure that you promote and you execute on getting yourself and your friends and family and those who you love vaccinated. It's important to prevent severe disease and to prevent hospitalization or death. So that's very important to keep that in mind. I urge you and I plead with you to go ahead and talk with your doctor and get that vaccine or get that booster, depending on what stage you're at. And also the symptoms that they're exhibiting, the people that are getting the Omicron virus or this variant from COVID, is milder symptoms, thank God. For that. So that's a good thing that we're seeing. We're seeing milder symptoms in the people that are getting infected. But we do have widespread fear of it in Europe and in Asia, as well as here in North America now. A lot of the countries are putting in rules and regulations and mandating that people wear masks, keep social distancing, especially in crowds that they don't know who's who and who's vaccinated, who's not. And then also, trying to mandate different forms of the vaccine. So that's something to keep in mind. And I just wanted to give a quick update on that. And, since Omicron in South Africa, the daily number of cases were, something around 300 to about 1,200. Now it's almost been quadrupled. They're saying some places are getting 4,000 to 5,000 cases a day. So it's something which is transmissible. It's something which is it's increasing. So we need to get ahead of that. Okay. Getting back to our topic, osteoarthritis, right? Let's break it down. Osteo means bone. Arthritis means inflammation. It is a common thing that we see in the young and the old, but more in the elderly populations. And why is that? Because of wear and tear. Wear and tear is something that happens as you age and as you utilize your body more and more for exercise, for running, for jumping, for skipping, for whatever you do in terms of utilization of the body. That adds to the problem of osteoarthritis. Osteoarthritis, there's many different forms. There's autoimmune osteoarthritis, what they call rheumatoid arthritis. Then you have the osteoarthritis of specific joints due to wear and tear. Some people will run a lot and they run on hard surfaces, on cement, on concrete, and that causes a lot of damage to their knees and ankles. And this causes inflammation of the bones. You'll get bone spurs. You'll hear this from your doctor. If they do an MRI or imaging, they'll see bone spurs from a lot of impact and compression, which are little bumps on the bone. It's not smooth anymore. And then from that, it'll lead to cartilage degradation, which means your cartilage starts thinning out. And once that happens, then you're getting closer to osteoarthritis. The worst condition would be if they tell you, hey, your joint is bone to bone. Bone to bone joints necessarily don't mean the whole joint is bone to bone, but a certain area they've observed in the MRI, and they've seen that it is getting close to bone. It could be 10%, it could be 20%, but that's the case. And the way you contribute to preventing such a thing is number one, you keep a good routine of fresh foods, fresh vegetables, um, non non-inflammatory foods, things that your body aren't reacting to, and then also vitamin D balance in terms of your vitamin D intake, your calcium. These things are very important in keeping your bones healthy, and then also exercise. If you do resistant exercise and you pump iron or you do weight bearing exercise, that is very good for the health of the bones at a young age and middle age and as you get elderly. If you're prone to a sedentary lifestyle because of your work or because of your whatever situation you have, then that also makes you more prone to osteoarthritis. um, those are things that people will complain, and some of the symptoms, of course, we'll get to. A lot of osteoarthritic sufferers will tell you that they have morning stiffness. Morning stiffness. Why is that? Because you're resting, and suddenly, when you get up to move, you have stiffness, and you're slow to move and getting back to your regular routine of things. So that's the morning's stiffness, and that usually gets as you move more, it gets better, and you get less stiffness. The other thing is that obviously when you get more joint pain with overuse. So if you're walking a lot, if you're running a lot, and usually the pain will get worse as the day progresses, and with the worst happening in the evening, you'll get the pain in the joint or in the bone. Of course, some people report clicking or crackling. That's something which is common on the joints, and that obviously tells you about a pathology. And then others will report swelling and tenderness in the joint, whether it's the knee, the hip, the ankles. And then also others will report a little bit of a lump or a little callus on the bone, a little bump that you feel. And then, of course, with all that comes decreased movement and flexibility of the joint. That decreases, and that's mainly in the hands, knees, hips, back, neck, but it could be at any joint in the body. So those are the things that are sort of common with osteoarthritis. Osteoporosis is a condition as well that's more common in women, and this happens with bone density issues. I think bone density issues when there's hormonal changes, when your normal hormones are off balance or imbalanced or unbalanced, then you get the bone making and bone destroying cells in the body. They become off their equilibrium. So what happens is that before it would be balanced, bone making and bone destroying cells, but now because of the hormonal deficiencies, you'll get stiffness and thinner bones because of osteoporosis. And osteoporosis is something which you'll notice in people if you see a decrease in height. You'll see them kind of humped over or slouched over, stooped. stooped posture, I think they call it. I'm trying to think of a specific term for it, but yeah, it's like a stooped posture, especially in the lower back. They'll have pain, and you'll see that like sort of the curvature of the body will take a hump, and they're more prone to fractures. These people with osteoporosis will be more prone to the fractures. And that's why it's recommended that they get bone density tests to see what the density of the bone is. Usually it's going to be very low density, and you have to watch out. And then these people, mostly females, they have to supplement with vitamin D, calcium, and nutrition as well. It's very important. Um, a lot of their another sign that they'll see is a lot of bone tenderness. Tenderness is there. Loss of height, I mentioned. Neck or lower back pain due to small fractures, and then the stooped posture. That's something where osteoporosis is indicated. So that's something to keep in mind. I have a few stats that I wanted to share with you in terms of osteoporosis. It's 1 in 3 women in the US and 1 in 5 men over 50 will have an osteoporosis event where the indication will come from a fracture. It'll come from a fracture. So 1 in 3 women and 1 in 5 men. They'll have some type of fracture, and then they'll discover that they have osteoporosis. The risk factors for osteoporosis is obviously genetic. Some people are genetically inclined. Inactive lifestyle, again, not moving around enough, regular exercise. Once you're over 45, your risk is higher. Insufficient mass, meaning that your whole body is very light, and the weight is very low, and sort of like some people have a weak constituency. And then, of course, the growth, the tinier, the smaller you are, the more prone you'll be to osteoporosis. Prevention and treatment. Obviously, if people smoke and drink a lot of alcohol or coffee, that's not good for osteoporosis. It exacerbates it. It makes it worse. And then the treatments, obviously, I mentioned calcium, vitamin D, hormonal balancing, restful sleep. You get good rest, and as well as dairy products like yogurt and milk are very good for people who are osteoporotic. And then also the general diet. You want to avoid inflammatory foods, and you want to have nutritious foods, cruciferous vegetables that give you a good amount of nutrition, and that's very important to keep in mind. Those things will keep you from getting osteoporosis. Those are some of the things you can do for that. For women, it's very important because the hormone and menopause after 48, 49, 50 is something which will cause that osteoporosis as well if you're not getting nourished and you're not getting supplementation of those things. So it's important to get that hormone replacement and make sure you talk to your doctor about it, because that's something that if you notice a decreased height, stoop presentation, back pain, lower back pain, some people might get oh, your vertebrae has collapsed. Oh, we saw an MRI, and we have small fractures that we see. These things are all indicative of trying to get better bone mass and bone density. So you should get a density test. Your doctor should normally order that if you're going through menopause and you're at that stage in your life. So that's things to look for in terms of osteoporosis. Getting back to osteoarthritis, obviously, the clicking and crackling sounds I mentioned, asymmetry affecting one joint more than the other, pain in the joints, obviously knees, hips, back, bone spurs. They'll let you know you have bone spurs. And then, of course, reduced flexibility and mobility for osteoarthritis. And these are, swelling, crackling, clicking noises. These are all osteoarthritis. slow to move in the morning, morning stiffness. These are all osteoarthritic conditions. And if you're aware of them, then you can find treatments for them and try to alleviate your symptoms and signs. That's very important to keep in mind. Um, for the next 2 or 3 minutes, I'm going to discuss a few different types of treatments that um, we should keep in mind when we're thinking about our bone health. Bone health is something where, if not taken seriously, it's the infrastructure of your body. It holds everything else up. So it's very important uh, to uh, to to do this before your joint deteriorates. The reduction of symptoms are possible, but it's more difficult. But you can still reverse certain things. It's very important to keep that in mind. Okay. The first thing that from a functional medicine standpoint that people recommend is to transform your diet into an anti-inflammatory diet, which means slowly removing inflammatory foods from your diet, gluten, wheat, all the processed synthetic sugars, synthetic foods, excessive sugars from your diet. It's very important, and you know what things are healthy and good. The leafy greens, the colorful vegetables, nuts, seeds, the quality of the meats you eat. You want to make sure that the protein is good and the fats that you take are nourishing fats. I would avoid canola oil at all costs. Canola oil has been shown in several different studies to exacerbate joint pain. It makes it worse. So I would take that out of your diet. Omega-3 rich fatty acids, those are very important. Wild caught salmon has that. Organic and grass fed beef, if you have to have, and then chia seeds, hemp seeds, flax seeds, walnuts, these are all good for the anti inflammation diet. It's very important. Some people get into the modified ketogenic diet and they utilize intermittent fasting to modulate their bodies and regulate the inflammation in their bodies. Um, Decreasing inflammation is the key to decreasing osteoarthritis and osteoporosis. That's something which is important to keep in mind. So, decreasing inflammation, however, you can do that, that would be the best way to get rid of the osteoarthritis and the osteoporosis. The other thing that many people forget is hydration. They fail to keep hydrated during the day, and this causes a lot of unneeded aggravation for the joints. It's very important to just drink pure filtered water. Alkaline would be best if you can get alkaline, and it's best to drink it out of a stainless steel cup or a bottle or a glass bottle. Plastic bottles have been shown to disrupt your hormones in the body, and that leads to different changes. So I would avoid plastic bottles because they tend to promote inflammation. So again, a flask, stainless steel flask, or glass. Use your water or alkaline water through that. And then, of course, you want to increase your intake of cartilage building foods like broth, bone broth. Um, at least some people recommend a cup of it a day. If you can do it, it has chondroitin, vitamins, a lot of nutrients that help joint health and decrease the inflammation in the bones. And they increase collagen, and it's rich in vitamins and minerals. That's something you can do. And then, of course, broccoli, cabbage, all the green leaf vegetables that kale, they're very good for detoxification. And also, they have compounds that are very good for the healthy joints. And if you can do that daily, steamed or cooked, and that's the best way you can get the nutrition. And then, of course, you have probiotics and prebiotics, right? You can take probiotics and prebiotics like fermented foods, things like kimchi, things like pickled things. Then, of course, you have yogurt, natural yogurt without the preservatives and sugars. These things all help your gut health, which in turn help your absorption of vitamins and minerals in your body. That's very important to keep in mind. And then, of course, exercise and sleep are very important as well. You got to keep that in mind. And, you want to avoid trans fats. These are all things that'll help you lead a more anti-inflammatory diet and anti-inflammatory life in terms of your bones and your body. It'll help everything. And of course, then there are the superfoods that have richness in antioxidants. Green tea is great for you. If you can do a couple cups of green tea a day, that'll increase all the good uh, um, anti-inflammatory factors in the body, as well as uh, the vegetables and the berries and beets. There's a whole list, and we can share that with you guys in the comments, where you'll have a list of anti-inflammatory foods that are super rich in antioxidants. They're called superfoods. If you consume some of those daily, that too will decrease the inflammation and keep you from getting osteoporosis and osteoarthritis. That's very important. And then, of course, spices that you cook with: turmeric, ginger, cayenne pepper. These are very important, and they're all anti-inflammatory and anti-pain. Those help you as well. Ginger is also a powerful anti-inflammatory uh, supplement, or herb, you may call it. There's been studies that's shown that ginger, and when they compare it to ibuprofen, is just as well or better than ibuprofen at causing anti-inflammatory effects in the body and on the bones. So these are some things you can do. And then supplementation with your vitamins is very important. Vitamin C, the collagen builders, the base builder, and then glutathione, which is also the um, anti-inflammatory master. Keep that in mind. And let thy food be thy medicine. That's always a motto that we have. But if you do suffer from these things like osteoarthritis, osteoporosis, discuss it with your doctor. There are many ways to help you. Surgery being the last option, but you can get IV supplementation of vitamins as well. And these things will help you and your nutrition of the body. You have to advocate for yourself with your doctors and discuss all options, and make sure that you're just not taking some medication that you don't need to be on for a long time. And have them explain all options. If you have any other further questions or concerns about osteoporosis, osteoarthritis, or questions or anti-inflammatory diets, please don't hesitate to comment or text us, and we'll get back to you as soon as we can. With that, I'd like to leave you, and you guys have a wonderful week, and we'll have another topic for you next week. Take care and stay safe.